My name is Steve August. I've been treating spines and other bits of the body for over 30 years. Now, this is my take on what I find actually works. I'm not really talking about the extreme scoliosis, and I completely agree with and support the scoliosis camps, the muscle approaches to strengthening the muscles which are opposing the direction of the twist. There's an extra bit though, and it's a matter of leverage. The thoracic spine, that's the middle back, develops this twist, and I won't go too much into the reasons for it. Scoliosis is often called idiopathic, which is just a medical term for, well, we don't really know why it happens. I think a lot of the milder stuff absolutely happens for very good, obvious musculoskeletal reasons, but they're often not checked out. For instance, if you have one leg longer than the other, which I do very slightly, then your spine tends to twist a little bit to compensate as you're growing up. So we're talking about milder scoliosis, not the sort of thing that you need a large brace for, not the sort of thing that you need surgery for. However, it's really common. Around about 3%, possibly 4%, the numbers are a bit unclear, of people will have a twist in the spine called a scoliosis to some extent or another. The problem is that it can get sore and cause problems, because here's my spinal model. If the spine is twisting to one side, then it tends to close down and restrict and limit the joints on that side. You imagine if you were walking around like that all the time, everything on that side gets a bit restricted and tight, and nerves can get trapped, and it's an ongoing pain. People with scoliosis also often get a kyphosis, which is the bending forward, so there's a bit of a forward hunch as well as the twist. Now, I don't for a moment claim that we can straighten everyone up. You can't. But it makes perfectly logical sense. If you've got a twist which is pushing you one way, especially if it's continuing and tending to get worse, and they usually do, not always, but they usually do, then if you can oppose that twist, you're doing the right thing. You're keeping the spine, as well as it can be kept, back in a straight line, straight up and down, and not twisted. It's a matter of leverage. Muscle support strength, muscle work, mobility exercises are all good, but they still have a limited amount of leverage on that particular bit of the spine. What we've come up with is something that we find absolutely ideal for putting more leverage on that twisting part of the spine to oppose the direction of the twist. So unwind it to some extent with any luck, hopefully stop it progressing further with any luck. But it's a totally logical approach. What we came up with was this thing here called Backpod, which is a New Zealand invention. It's, I'll show you a cross section. It has an unyielding polycarbonate core, which is massively strong, with a cushioning green outer, so it's a bit more comfortable. They will not collapse underneath you. We've driven a BMW over 1 to test it for Europe and a Jeep Cherokee to test it for America, and the Backpod was fine in both cases. So they're incredibly strong and shaped to the contours of your spine. Now, if you've got a scoliosis twist, this is the spine looking from the back, looking into the bumps that you see down somebody's back when they bend forward. Say it's twisting out to one side. The ribs are attached to the spine, so what you will see is that the ribs on the side to which the twist is going will be raised up. Now if you think about it, if you lay somebody on their front and you saw the ribs raised on that side, and that's an easy way of picking it up, just lie somebody on their front, look down on them, see if the ribs are raised on that side. If that's the case, then if you put your fingers on those ribs and push down, so you're effectively using the ribs as crowbars to unwind the scoliosis. When I say unwind, I mean oppose the direction of the twist of the scoliosis. It's completely logical, mechanically and musculoskeletally. And that's often what physiotherapists do. They'll actually do a mobilizing technique where they're just jiggling those, using those rib hinges and jiggling to oppose the direction of the twist. Now, you could do the same thing yourself at home, ongoing, and probably more effectively with one of these things. Because if you take the Backpod and you put it on the floor and you lie back on it, on your back, with the curve of the Backpod sitting over the curve of those raised ribs. So that will be between the inside of the border of the scapula and between the center of the spine itself. If you're lying back on the Backpod, which is acting like a fulcrum, it's using your whole upper body weight through those ribs as crowbars to unwind, or at least push in the direction of unwinding, that twisted part of the spine. It works really, really well. And you can lie back on the Backpod for several minutes, move it up and down a bit to hit different ribs. And it's essentially using the ribs as crowbars onto the spine to oppose the direction of the twist of that spine. It's completely logical. The other thing with the scoliosis as a problem is that it tends to be in association with a bit of a hunch, also called a kyphosis. In this case, you use the Backpod in the standard way for which we developed it, which is to oppose the eye hunch. This is the usual hunching thing that people get when they've been spending all their time on computers and laptops, tablets and smartphones. So if you're lying back with the Backpod in the centre of the spine, your upper body weight is then stretching the tight spine back the way it used to be and unwinding that hunch as well. So with the Backpod you get the two things for scoliosis. So I hope that is useful. As well, on our website there's also home massage and strengthening exercises and what you need to know about posture, which are the other components that you need to get your thoracic spine back towards its normal as it can. So I hope that's useful. This is a New Zealand approach. We've been winning international awards for it. We think it's highly useful, just that specifically for scoliosis, it seems to work better than anything else. I hope you find this useful. Cheers.